Sure, taking a deep breath after that interview and trying to, just contain yourself when you think of these horrific incidences that are happening around us and next door to us, because there are neighbors, there are people living there, and that's the reality. There must be somebody who can help with all of this. All right, let's move on to our next interview. With the quality of life in mental health facilities still under question, and of course we are now with Mental Health Awareness Month in October, brings the topic back to the fore. With upgrades to facilities such as the Sterkfontein Psychiatric Hospital in Gauteng as just one example, we discuss the state of our local mental health care. So joining us on the program, we've got in our Pretoria studios, we're so happy to have with us Dr Yogan Pillay. He is the Deputy Director General for Health. Dr Pillay, thank you for your time. Thank you very much for joining us. And then, of course, here in the Johannesburg studio, we've got Tyrone Pols. He's the spokesperson for the SA Medical and Educational Forum. Tyrone, thank you very much for being with us here on the program.
Thank you, Leanne.
I'm not sure if we're able to hear Dr. Pillay. Dr. Pillay, can we just try and get a hello from you again?
Good morning, Leanne, and good morning to the viewers.
Much better. We couldn't hear you a bit earlier, but I'm glad that we've got that. Let's begin with a bit of a positive aspect, and let's discuss the importance of the upgrades at something like the Sterkfontein Psychiatric Hospital in Gauteng and what this will mean for patients, specifically relating to the new occupational therapy and sports facilities. Dr. Pillay, if we can begin with you on this one.
Thank you very much, Leanne. Leanne, mental health is a critical issue, not just in South Africa, but globally. And there's been a recognition globally that we are not investing sufficient amounts of resources into taking care of people with mental illnesses, mental disorders. And, that's resulted in now a global approach to revisiting the way in which we focus on mental health. And the idea is not only to focus on psychiatric hospitals, Leanne, it's to focus on facilities at all levels of the health system, including at primary healthcare level, as well as in general hospitals where we now have psychiatric units. With respect to psychiatric hospitals, we have 19 of them in the country, and we are in the process of building a new psychiatric hospital in Mpumalanga, for example, and upgrading the others, like you've mentioned. The other hospital that's currently being upgraded is Weskoppies Hospital here in Pretoria. So there is a real concerted effort to upgrade our mental health services in the country, including our psychiatric hospitals.
Okay. Let's talk specifically about this partnership. And Tyrone, I'm going to ask you how it all came about, because the facility which was unveiled last week is a partnership between the SA Medical and Education Forum, which is SAME, the IDC and the Gauteng Health Department. Talk us through this partnership.
So, Leanne, how it works is the same foundation specializes in private and public partnerships. We're a national non-profit organization, and what we do is we work with the Department of Health and we work with the private sector, and we link the two strategically. We find where there's a need, where there's an immense need, and we find the funders, and the same foundation acts as the implementing partner. So when we go to facilities all across South Africa, just tracking back from Sterkfontein Psychiatric Hospital and going to Khayelitsha, which is a district hospital in the Western Cape that has a psychiatric ward, it was well documented that they had a shortage of beds. And same foundation found that need, that there's reports of patients sleeping on the floor.
Yeah.
Psychiatric patients sleeping on the floor. And what we do is we link up with the private sector, with our donors all across South Africa, show them the need, and as the implementing partner, NGO, the same foundation will go in and attend to that crisis.
Yeah. So, when we look at facilities here in South Africa, but in Gauteng, it's hard not to think that they are in an appalling state, because, and again, I bring you in, Dr. Pillay, I do hope that there has been a major shake-up within these institutions and facilities ever since what's happened at Life Esidimeni. So if we look at public mental hospitals, what are the total number that we have currently?
Well, Leanne, I'm not sure if you're talking to me, but if you are, we have 19 psychiatric hospitals in the country in the public sector, And we have more than 40 of our general hospitals with psychiatric units, which also admit patients with psychiatric conditions.
What are the conditions of them, Dr. Pillay? I'm sorry, again, talking to you.
Well, they vary, and I think what we must recognize is that many of them are actually very old buildings. For example, you know, the Fort Napier Hospital, parts of the Fort Napier Hospital in Pietermaritzburg, were really from the Second World War, and they were used at various stages as part of the war effort, including some of the wards there that have now been refurbished, thankfully, were used as stables for horses. So these are very old hospitals, and there is now a national plan to revitalize all these hospitals, including the ones in Gauteng.
Which is in a desperate need of revamping and in a desperate need of proper care. Because, I mean, when we heard what Tyrone was saying, I mean, you've got psychiatric patients that are sleeping on the floor, and many of them in conditions that are absolutely inhumane.
No, that's right. We have also been partnering with the private sector from the National Department of Health, and the Minister will soon make an announcement about 2 hospitals that we will be, in partnership with the private sector, refurbishing a few wards. But there is a huge infrastructure program that's currently focusing on refurbishing these hospitals. A new hospital in Kimberley, psychiatric hospital in Kimberley, will also soon be opened. It's almost complete, and it should be opened within the next few weeks. So there is a nationally concerted effort to reform mental health services and also revitalize our psychiatric hospitals.
Yeah.
But again, I would like to emphasize, Leanne, the idea is not to only focus on psychiatric hospitals, but to focus on mental health services from prevention and primary health care level all the way up to those that need hospital-based care.
Yeah, yeah, certainly. And I mean, this is becoming more and more an imperative because we are seeing criminal cases, as we saw yesterday with this Nicholas Nina, now going in for evaluation and is going in there to be assessed. And this is all linked, whether it be in the health department, the criminal system, and the lack of safety to people as well that are out there that are falling victims to these patients that do need help. They desperately need help. But that's another conversation that we can have. I want to, Tyrone, ask you, why did you decide to go the psychiatric hospital route with this venture?
This project was born out of, unfortunately to say, the Life Esidimeni tragedy. And it puts a focus on the need for specialized facilities such as Sterkfontein. And the Deputy Director, Dr Pillay, was saying that mental illness should be treated at primary healthcare level, which is a very valid point. But the concern here is that if your specialized institutions aren't able to treat effectively and deal with the capacity, how can we expect community-based medical centers to treat patients? And that's where the problem comes in of patients not being treated properly. You have conditions such as anxiety and depression that are overlooked because facilities are understaffed. And what we decided to do was focus on a specialized facility, occupational therapy specifically, because occupational therapy is a very important part of medical treatment for mental health care and rehabilitation and reintegration into society. And more efficient healthcare, which means that it creates the system of you sending better treated patients back into society who have now learned coping mechanisms and have the resources while they're being treated to upskill themselves, run a restaurant, entrepreneurial skills, do research and media. All these factors come into play. So while they're at their specialized facility, they are getting educated and upskilled so that it's an easier process back into society.
Yeah. Have you worked with the department before on ventures?
The same foundation is 15 years old now. We work nationally and we work with the Department of Health extensively to identify areas that need assistance.
Okay. A question that, Dr. Pillay, I think I asked it to you a bit earlier, but perhaps I just need to emphasize it again. If we go back to Life Esidimeni, how has the situation improved in the department and in those facilities since those days?
Well, as I said, Leanne, we've been doing a large number of things to both strengthen our psychiatric services as well as our primary healthcare services. Leanne, let me say, you know, while we're focusing on psychiatric hospital, the estimate is that between 1% and 3% of the population will have what's called severe mental disorders.
Yeah.
But 30% of the population will, over the lifespan, our lifespan, have what are called common mental disorders like depression and anxiety. So we need to take care of course, the 1% to 3% who need care in our psychiatric institutions, but also provide services for the 30% that need outpatient services for what are called common mental disorders. And there is where we are focusing on training our doctors and nurses in providing services in our general hospitals for what are called common mental disorders, and also strengthening our primary healthcare services to detect these conditions early enough so people can get access to early interventions before these conditions become severe, needing psychiatric care in inpatient psychiatric hospitals. So it's very important for us to realize, you know, where the burden of disease is and illness and where to invest the money. You know, currently, Leanne, we're spending 44% of our total mental health care budget on psychiatric hospitals,
Yeah.
and only 8.8% on primary health care. Now, we need to revisit that as well, even as we fix up and strengthen the services we provide in our psychiatric hospitals.
You know, it's quite interesting. I'm going to quote the Lancet Medical Journal. They bring out a study, and in fact, this year they cited the Life Esidimeni tragedy and spoke about the fact that this tragic case that occurred in South Africa when the Gauteng Health Department stopped funding a large 2,000-bed facility and allowed the discharge of vulnerable people into unlicensed community residential families, leading to the death of 140 people. They basically saying that this is something that highlights how mental illnesses still routinely suffer gross human rights violations, including torture. Now, to hear this is absolutely heartbreaking, and that was here in our country. This is a global survey, that we do not treat people with mental illnesses properly. But the reality is that the cost of supporting these mental disorders will cost the world economy $16 trillion by 2030. So the cost is increasing. It has become a bigger burden on the state, but we need to do something about this and be vigilant to it. So talk to us about this, in Tyrone, from your opinion.
Leanne, can I speak to you about solutions and how we will approach a situation like this?
Yeah.
I've recently finished a case study of a flagship hospital project for Same Foundation in Gauteng. It's the Laratong Hospital in Shamdo on the West Rand. And over 7 years, we've invested 20 million rand at this hospital in infrastructure, upgrades, expansions, and medical equipment and training for doctors. But the key here is that for the past 4 years, we focused solely on mother and child healthcare. That is from when a woman's pregnant all the way through to when the child is 12 years old. And at the time, the mortality rate of infants was 33 to every 1,000 births. That was slightly above the national average at the time, and the National Development Plan states that the department would like to bring this down to 20 deaths per 1,000 live births of infants. And working with the hospital, and this is where public-private partnerships really make a big difference, is that, and with a well-run facility and good management and partnerships. What it allows us to do is we invest in upgrades of facilities to state-of-the-art level, often better than private hospital. We expand capacity of these units. We provide them with the latest medical equipment that you get in the world. And this allows a well-run hospital to redivert funds to increase staff capacity, which they did. And obviously, we invested in the staff's quarters and to boost their morale so that they're working in better conditions. And just in 4 years, what we did was we took the ratio of 33 to 1,000 infant deaths down to 11 infant deaths per 1,000. That is 100% better than the 2030 plan. And that's what a public-private partnership can do in just 4 years. And if we take this blueprint nationally into mental health, into community facilities, the thing about Life Esidimeni and why it's so tragic is that the intention is to make mental health care accessible in the communities. It's researched by the World Health Organization that the poorer have to travel a lot longer to get to facilities and to visits. So it's taking it back into the communities. But if you can do public-private partnerships where we can get those community facilities upgraded to the level that they should be, it frees up funds for the department to focus on the chronic shortage of medical health specialists.
Indeed, and many, many other issues, because, you know, we know, and I have to wrap the interview. So, Tyrone, thank you very much. And Dr. Pillay, I mean, just on the back of what we've heard Tyrone say, if you could just wrap very quickly, by freeing up funds, because, I mean, we even look in the Eastern Cape at the Malekapuru Magoba, on the Tower Hospital, the mental hospital, where the health ombudsman put their report out. And what they emphasize is that the conditions at hospitals are a systematic failure of the health department. Freeing up funds, can you sort this out? Is this one of the ways of sorting out the problems in the health department?
So, Leanne, thanks very much. And we welcome Tyrone and the partnership we have with the private sector. And, of course, we will extend and strengthen that partnership. And Tyrone is right. We need to strengthen the management of our facilities and use the money that is made available to the public sector more efficiently. And this is, you know, one of the things that our president said also during the health summit that was held a few weeks ago. So there's a significant commitment by the Department of Health at all levels to strengthen the health system and do everything we can to ensure that our patients have the best quality care, whether for physical health or for mental health. Right. And clearly we have to treat mental health with the same level of importance that we give to physical health.
Absolutely.
Both in the home, the family, schools, and in our public institutions.
Thank you for joining us here on the program. That was Dr. Yogan Pillay, the Deputy Director General for Health, and Tyrone Pols, spokesperson for the SA Medical and Educational Foundation, talking about partnerships and also highlighting the Mental Health Awareness Month that is in October, which was last month, but it's a very big story to follow. Let's take a break. News after this with Sakina.